This is Sunny Guadaram with the Striker, Texas. We're here with Dr. Brazil at Austin Sports Medicine talking about the rotator cuff.
The rotator cuff are a small group of muscles and tendons around the shoulder that kind of hug tightly to the shoulder and basically position the arm in space while either your big muscles are working or your hand is working. So yeah, when we talk about rotator cuff injuries or aggravation, we think of these injuries coming in two different settings. One is repetitive overuse. So somebody who's doing a lot of overhead activity, throwing, goalie throwing, blocking kicks overhead, they're prone to aggravation and overuse of the rotator cuff. And then there's the throw-in. So someone who's doing a lot of throw-in overhead use are prone to aggravation of the rotator cuff. Then the flip side are injuries to the rotator cuff where it's more of a traumatic event. So those are falls, diving with an outstretched arm. So the goalie again would be probably most at risk in soccer for injuring the rotator cuff in that traumatic setting.
Unless you are a flopper.
Yeah, a really violent flop, you're really trying to sell it, you might injure your rotator cuff.
So this is something that would probably happen like over time. You would start to develop pain unless it was that one traumatic experience.
Correct. So often we see overuse type injuries that take time to develop, and they're slow to develop. They're also slow to recover. So you have to be patient. You have to really focus on modifying your activity, modifying the stress of the shoulder, getting it to calm down, and then getting that strength and function back. And that just simply takes time.
Is there anything that you could do to maybe prevent something like this happening?
So we do a lot of maintenance work where if we maintain the strength of the shoulder, maintain the strength of the rotator cuff, reduce the susceptibility to fatigue, then you're less susceptible to those overuse injuries. And so maintenance exercise and a lot of what we do with physical therapy, once we sort of break that pain cycle and patients become independent from therapy, they're no longer under therapy supervision, they're doing a lot of maintenance exercise to try to prevent recurrence. For a lot of these athletes, you're so used to working on maintenance of skills, and it's very game specific, sports specific. A lot of these maintenance exercises are more body maintenance, injury prevention, and so they're kind of universal across multiple sports.